Good afternoon, everyone. Happy Monday. Nice to be with you all. This is the Health Planning Council / Tompkins Health Network Advisory Board meeting. And we are going to start with approving minutes. And then we have some really great updates and presentations for you today with a plan to adjourn at 1:15. So hopefully majority of you can stay until 1:15. Because we didn't have a quorum last month, you might recall we met at the library, which it was a wonderful meeting, but slightly smaller turnout. So we didn't have a quorum. So today we're voting on the April minutes. Yeah, so I'm going to ask if anybody has any changes, corrections to the April minutes. Okay. Can I have a motion to approve the April minutes? I think, is that you, Beth, approving? Yes, okay. Can someone second?
I'll second.
Thank you, Ed. All in favor, maybe hands up or thumbs up in the chat. Awesome. And anyone opposed? Any abstentions? All right, maybe I was supposed to do all in favor last. I honestly don't know how I manage each month to mess up the order. Okay, so I think we can say April minutes are approved and get into announcements, which we, Nicole, it looks like we are open announcements today. We don't have any like pre-planned announcements. Lots going on in our community last week and coming up this month. So I'm expecting that we are going to hear from several of you. So please feel free to unmute and let us know what you'd like everyone to know.
Hey, Lara, you can plug your Tuesdays for people that weren't there last month. You can mention that.
Sure. And also just to point out to folks that Lifelong Summer Catalog, there's a link to it in the chat. Thank you, Liza. Tuesdays for the remainder of June, we are, Week Yuga Health is co-organizing a weekly wellness series open to everyone in our community, all ages, no fees associated with it. Every week there's a free yoga class. This is in Ithaca Community Gardens, which is right across the way from Aldi, next to the big construction site happening on Route 13. But we managed to have a really wonderful and peaceful yoga class despite the construction. And we also offer opportunities for people to get appointments, schedule an appointment with a primary care provider. And today we're going to have some recipe tasting. Each week it's a little bit different. So please consider joining me there and spreading the word about it. Other announcements.
I'll share. We've got something coming up here. So TC3 and HSC are partnering to develop a nonprofit leadership micro-credential. This micro-credential is specifically focused on supporting sort of folks who are currently working in or aspire to be working in middle management positions in nonprofit organizations. We're having our second iteration of a focus group this Thursday, June 12th from noon to 1 via Zoom. If anyone would like to register or share the information, I'll put the link to register in the chat.
There, I can share that. Hi, everyone, that we'll be sharing out results from the community health survey that was completed back in February, and probably through press release and on our website. But then we're also going to have staff at upcoming community events the last 2 weeks of June to also share information about the survey. So we'll, I'm sure, see many of you at those events. Thank you.
And I was just gonna say, I know she just came in, but Siobhan, do you want to mention what's happening at Southside this weekend?
Sorry, y'all, I'm driving. I'm in the middle of my kid's appointment. Southside Juneteenth Festival, 12 to 6, corner or the T of South Plain and Cleveland Avenue. It'll be wonderful vendors, food. We've got performers, all the good stuff. Hope to see you all there.
Including my daughter will be performing. Don't know
Yeah,
what time, otherwise I'd share that.
I don't know either. We'll have to check in with it, I see.
Sounds good, Siobhan.
We actually have 2 days in a row of fun. So Juneteenth on Saturday, and then on Sunday, there's Pride in the Park at DeWitt Park. Cuba Health will be there with a first aid station and also giving out other health information. Maybe some other organizations here will be there or just coming out to enjoy the fun. That's all. That's 10 to 6 on Sunday. We have more time budgeted for announcements, so I'll give another awkward pause to see if anybody else wants to share.
I will go ahead and share real quick. So we have partnered at the Ithaca Free Clinic with the Guthrie Maternity Oasis Mobile. They come out and do mobile prenatal care. So they will be at our location on July 23rd from 10 a.m. to 3 p.m., as well as August 13th from 10 a.m. to 3 p.m. If anybody is interested in joining us, please shoot me an email and we can try to get something worked out. I know some agencies have expressed interest in setting up a table. We, of course, welcome that, as does Guthrie. So let us know and we can try and get something set up. All right, thanks.
Thanks,
Is that an
Derek.
indoor table or outdoor table?
We will be outside and, because it won't be the weekend, I'm sure the weather will be nice. If this were on a Saturday, I'd say it'd be inside because it'll be raining. But as it's during the week, I think we should be good weather-wise.
Derek, I was just going to add that I reached out to the scheduling person for the maternity van to give them some more suggestions for locations in Tompkins County too. But certainly if anyone on this call, wants to host or has suggestions about where it might be helpful to have this van that can provide, prenatal checkups, that sort of thing, especially in some of the more outlying areas. We're gonna try to coordinate that a little bit more and help promote when they're in our county. So I can share that out to Nicole maybe if we get sort of more of a schedule from them.
Last call. Okay. All right. So thank you all for sharing the updates with the group. Our next item is we have Samantha Stevenson, Director of Operations for REACH. has an update on the Reach Outreach Worker Program.
Hi there. I think maybe I have this little virtual flyer that I can share. Maybe that would be easier. Am I allowed to share my screen here? Let's see. Make that a little bigger. Okay, so this is an update on the Community Outreach Workers Program. This program was formerly facilitated by Family and Children's for those that are familiar with it. And then it hasn't been in operation for a few years. So Reach responded to an RFP a while back and got awarded it's now considered a pilot program, I think rightfully so, because a lot has changed in the past few years that it hasn't been operational. We've been working with Tompkins County Whole Health and the county kind of as a whole and the city. They kind of co-sponsored it, which has been nice because we've been able to work with key people from both the county and the city to provide the information that they know on kind of the frequency of calls, the nature of what those calls are. And we've been able to kind of like better assess where we can plug in that and how we can plug in to be the most helpful. So this pamphlet kind of highlights, it's like a zoomed out summary of the program. It's for downtown Ithaca. There are not rigid guidelines on like what downtown means. So I think there has been confusion historically that this is just for the Commons, and it's not. It's just for the downtown area in general. So here's the phone number right here. And I can share this with you too, Nicole, if you want to send this out virtually to everybody. Okay, that's what I'll do. So in this phone number, you can call or text. It's monitored by our workers Monday through Friday, 9 to 5. We are still actually recruiting for one more full-time employee. So if anybody knows anyone who may be interested and do well in this outreach type position, send them my way, please. And it kind of gives a summary of when to call. So if someone is escalated, but in a nonviolent conflict, if you are recognizing that someone may need some social supports for housing, food, clothing, personal care items, if they need kind of a warm handoff and a referral to another resource or community-based organization, those are all appropriate reasons to call one of the outreach workers. And you can again call or text that line. And the goal is to just improve access to resources and supports such as food, personal care supplies, medical care, mental health services, housing, financial assistance. We really wanted to be clear that because Reach has such a large presence in the outreach stakeholders and we do a lot of different services in that arena. So sometimes it's intensive case management where we really are the direct service provider for addiction medicine or the direct service provider for mental health care. These positions are more like a triage type position. So they themselves, the workers in the downtown area, are not providing direct intensive case management services. Rather, they're the responders and they're kind of assessing people's needs. They're de-escalating in the moment. They're putting in referrals and they're kind of seeing through these warm handoffs. Because we are a resource-rich community, we do have a lot of resources available to people, but sometimes there's barriers for people and they're not able to get through them. So they kind of just get stuck sometimes in the downtown area. So that really is the purpose of this program. We launched this program, I think it was in the end of March. So it is still very new. We're trying to do a good job keeping track of the number of calls, the nature of the calls, the geographical location of where people are calling from, which businesses are calling, so that we can really get an accurate snapshot of who's using this program the most, where the highest needs are. And so that's where we're at. And I'm happy to answer any questions if anybody has some.
Thank
I
you,
don't have any
Samantha.
questions, but I just wanted to say the brochure that you developed is really nice.
Oh, thank you.
Yeah,
It was actually Whole Health that developed it.
yeah, very
Thank
nicely
you, thank
done.
you. I think I'll also give, I can stop sharing now. I do have one more unrelated, but maybe related update, which is Reach was also awarded a grant. It's a HUD grant. It's through the IURA, and it's to support people who are experiencing chronic homelessness. And this grant will be, we're ready to kick off, I think, any day now. We're just kind of finishing up the last parts of building the foundation in for it. It will be housing, well, I shouldn't say the number of people that it's housing, but rather the number of units. We'll have 12 secured units on site at the Art House for people experiencing true homelessness. It's zero barrier housing, and it's a full-time intensive case manager that's a Reach employee that will be on site 40 hours a week and directly connecting these folks with medical care, behavioral health, addiction medicine, social service supports, whatever they may need within the community and within Reach Medical. And also helping them get through kind of the DSS process and getting them on the Section 8 waiting list and recertifying them, getting them a valid ID again, all of these barriers that we're all really familiar with that kind of hold people back at times. So we're working with 211 and the COC to determine the people that will be eligible kind of 1 through 12 when we open this program. But we're really excited for this initiative. We'll be able to offer people moving support and zero barrier housing into a fully furnished apartment with an intensive case manager 40 hours a week. So we're excited to really kind of like put true supportive housing in place for folks that have been experiencing chronic homelessness for a long time. I don't have an exact date that we're going to start, but like I said, we're kind of in the tail end of setting it up. So that's another update that we have. And I'm happy to answer any questions if there are any on that.
Chris?
Hi, Samantha. I was in a meeting the other day and there was some confusion amongst the folks there whether Reach works with folks who have alcohol addiction or whether it was just opioid addiction. And that was a question sort of in itself around some sort of direct services. And I'm just wondering if your answer to that question also extends to any of this other work, which sounds great and important. Thank you for doing that.
Yes, anybody with a substance use disorder, it does not matter the substance we work with.
Thank you.
I think there has historically, I have heard this before. I think because we're in the midst of an opioid epidemic, that oftentimes is the substance that kind of is centric to conversations, centric to services. So it does cause confusion. So I'm glad you asked that. Thank you.
Samantha, I had a question about, well, it's a two-part question. First, it sounds like consent is not required to make the call on behalf of someone who appears to have a need. And I wondered, like, related to that, how soon after you make a call does somebody come out to check on this person? And has there been any situations where there's sort of some feelings around being called for?
Feelings from the people who are.
Right. So like if you're calling on someone's behalf and they didn't ask for this call to be made for them, is that a tricky situation? And also, like, how soon does somebody come out? Maybe it won't even be a parent who made the call.
Yeah, so because we're still in the early stages of this, the program is not super busy at this time. So if you're calling during business hours, they usually do respond pretty quickly. I would say within 30 minutes, under 30 minutes. We haven't encountered someone who has been against receiving services at this point. I'm sure that that's coming. These can be really tricky situations to navigate. I think one of the benefits of this program kind of being housed at Reach right now is our staff tends to know a lot of the folks that people are calling on. And that has worked well because in most situations so far, we have a good relationship with people. So we have things to talk about them, we understand at least mildly what's happening in their lives. That certainly won't be the case for everyone, but we offer training on de-escalation and trauma-informed approaches to all of our outreach workers so that they're kind of better equipped to navigate those. But right now, yes, if you call during business hours, it's a pretty quick response. And I think their consent is not required. One of the main goals of the program is to replace how many 911 and police calls are happening for people that really aren't having a threat of violence or any danger. It's really just like social needs or substance use related or mental health related. So we're trying to plug in. So I would think of it, and someone else has asked a question similar to that. And I was like, it's kind of the same thing as when you call the police on someone. You don't need consent. We're just trying to kind of reframe people's thinking of like, is this actually a police call or could this be an outreach workers call?
Super helpful, Samantha. Any other questions? I think we have time for one more question. All right. Maybe Sam, could you put your email in the chat in case anybody has a question afterwards?
Sure.
Thank you so much.
Thank you.
All right, so next we have two presentations, one from Tompkins County Whole Health's Mental Health Clinic, Hillary Riley, who I will introduce in a moment. And that will be followed by a presentation from Jenny Miller, COO of the Mental Health Association. So starting with Hillary. Hillary is the clinical director at Tompkins Whole Health, a role she has held since February 2025. She brings over a decade of experience in residential foster care settings, where she has provided both clinical and administrative leadership. Before joining Tompkins Whole Health, Hillary served as the Director of Admissions and Director of Hard to Place Services at the William George Agency. In this role, she oversaw care and services for youth with complex behavioral and emotional health needs. Her earlier experience includes working as a mental health clinician in an Office of Children and Family Services facility and in a group home for adolescents. Hillary's extensive background reflects a deep commitment to supporting vulnerable populations and advancing behavioral health services across care systems. So very happy to have you with us, Hillary. Welcome.
Thank you so much. I'm really excited to give as much information as I possibly can about our clinic and all the things that we're doing. So I really appreciate you asking me to come present today. Hoping to just give some general information about what we're currently offering. And then, of course, if anyone has questions, please ask. So I'm going to share my slideshow. Okay. Okay, so I wanted to talk about our Brown Road Clinic.
Hillary,
that we
sorry to
opened-
interrupt you.
Yep.
We're seeing your notes. You have to swap to presenter view.
Okay, see if I can figure that out.
I think it's under display settings and you should be able to swap over there.
Um,
Do you see at the top, it says display settings?
Yes.
If you click on that arrow, swap presenter view,
Is that better?
that's great, perfect.
It's switched. Okay. All right. So I just want to talk about our Brown Road Clinic. We opened this up in November. And we've been slowly adding clinicians up there as needed. So at this point this year, we're currently serving 457 clients up there we've had about 1,000 appointments this year. The goal really for this clinic, there's a couple of things. So one is that we have 4 of our children and youth clinicians up in the clinic. So it gives the opportunity for families to come in after school. We have quite a few families that come in. The parent gets to have counseling at the same time as their child. So we can kind of meet the whole family's needs right up there. People are finding it really convenient due to the parking, and it's closer to a lot of our rural communities. So it's a lot easier to get to, a lot more accessible. And trying to really partner with our public health programs. And we're currently hiring a additional full-time mental health clinician to be up there. And my goal really is to get them specialized in treating some of the concerns that a lot of the public health clients have, right? So working with the entire family and partnering with them. So right now we currently have 3 adult clinicians up there as well. We've added a peer specialist as well. Our peer specialist that works at the Brown Road Clinic is certified to work with children. So that's been really helpful for him to be up there and partnering with the children and youth clinicians. And we will be able to offer psychiatric care up there. In about 2 weeks, our psychiatric nurse practitioner is going to be up there on Wednesday afternoons. And she'll be going up with one of our community mental health nurses. So, our goal is really to just make this as accessible as possible for the community. So clients should be able to go up there, get their counseling, meet with their psychiatric provider. If there's additional needs that they need from the nurse, they'll be able to see them all up there at one time. And we're going to expand those hours if we need to. So if we start getting more clients that need other hours, we're definitely flexible to be able to meet those needs as well. So for our Green Street Clinic, last year we served about 2,000 adults and 500 children. And so far this year, as of June 1st, we've served about 1,600 adult clients and almost 400 children and youth clients. We're fully staffed right now, which is great. In last year, we hired about 7 mental health clinicians, additional to add to our team. So we're fully staffed. We have our 2 psychiatrists, 3 psychiatric nurse practitioners. We have nurses, adult clinicians, our children and youth team, and our forensic social workers as well. We're also able to promote some senior clinicians. So we have 5 supervisors that are able to provide, quality supervision, provide training for our staff, and just some general oversight, which I think has really helped just ensure that we continue to keep our staff. I mean, they're getting a lot of clinical supervision each week, so it's been really helpful. We added 2 peer specialists in around November. We also added 2 peer specialists. So they are able to offer services right now. They're offering services to about 180 clients. So what they're doing is helping people with just to get rid of some of the barriers that may prevent them from getting treatment. They're able to go right out into the community, meet with people, help them fill out paperwork, help them with transportation. And then they also really helpful with engagement as well. So if we have someone that's maybe not sure if they want services, they can meet with a peer for an unlimited amount of time and work through some things with them and help them engage with a therapist here. Something else we're doing right now is we're hiring a court navigator. So what that position will be is they'll be positioned at our courts. And they're able to help people who have just been, charged with felonies and misdemeanors in the criminal court system, help them navigate services. So whether that means that we're helping them fill out housing applications, we're connecting them with someone in the community, or we're doing a mental health intake with them. They'll be right there, as soon as the court is over, able to meet with them. Additionally, they'll be doing some check-ins along the way to make sure that all their needs are being met. And if there's something that changed, they'll be there to help them with that as well. So really excited for that. Currently, looking to hire that position. And that's going to be a licensed clinician as well. So we're offering a lot of groups at the clinic. Here's a list of them right now. And our goal is really to find a way to offer more groups out into the community, just to reduce some of those barriers of people, trying to get here. It can be really difficult. We offer virtual groups. However, sometimes the screen's off. There can be a lot of issues there as well. So our goal right now is to see how we can get out into the community to offer more groups. So right now we're offering one at the SRO. It's been really successful. The clients really enjoy it. And so, we'll continue to try to do more of that as well. So this year we added 2 new satellite schools. We're currently in 14 schools in Tompkins County. Our children and youth clinicians spend about a day and a half, sometimes 2 days in some of these school locations, where they're offering therapy sessions right there at the school. That's been really successful. I've actually just had someone reach out to me today and ask if we can get more services in the school, because it's so convenient for families to just have that provided for them right there. We just got some technology from a grant so now we're able to do intakes right at the school, which will reduce even another barrier of people trying to come to Green Street to do an intake. We can do it right there at the school. Over the summer, we've been trying to plan some groups at summer camps. One of our clinicians is at the Village, so she'll continue to do that as well. And then we're looking into some things at the Enfield Community Center. So we'll still be at the satellite schools over the summer for people who are kind of in that routine, but we're trying to branch out a little bit more. We're offering in-home therapy, or we can just go right to them. It's a little bit more difficult to engage clients over the summer. So again, just really trying to do everything we can to improve engagement. So another service we have is our care team. So these are licensed clinicians that are paired up with the Sheriff's Department and IPD. So they're responding to calls, where there may be a mental health crisis that doesn't necessarily need, maybe the client doesn't need just a police officer to go to the hospital, and they're doing a lot of de-escalating. Something else that they're doing is follow-up, right? So if they go out and someone's in crisis, they're calling them the next day to follow up and see, hey, after yesterday, are you interested in any services? They can also do intakes, or they can connect them with other resources in the community. So that's been very successful. IPD just launched theirs in 2024, and they're trying to launch another one this year. So it'd be really great to have more clinicians with them as well. We just applied to become a designated OMH mobile crisis team. So what that'll do, that'll get us certified, and then we'll be doing more outreach to them as well. So these are just some things that we've been doing to try to improve our coordination of care, with public health, but also like among the community organizations. So just really what this has been is a lot more communication, and, meeting with the hospital to make sure that clients that are coming out, we're ready for them. We know what's going on with them. Trying to improve our relationship with our local housing so that, we can go in and offer services there. So I just want to remind everyone, we do have open access hours. So the hours are listed right here. And clients, anyone can walk in and they will get an appointment that day. As long as they come in between those hours. They're also able to call for an intake appointment. And that'll be scheduled out usually. If they want to schedule, it's going to be about 2 weeks. But if they want, otherwise they can come through during our walk-in hours. Our process right now is after your first intake, you'll get a second intake or appointment in about 2 weeks. It could go to 3 weeks, but we're not going past 3 weeks. It just really depends on spikes with the season. So because it's spring, we are scheduling out about 3 weeks, but for the majority of the year, it's about 2 weeks from their first appointment to their second one. After that, it's kind of triage depending on what the client would like. Do they want to be seen biweekly, monthly? Are they looking for medication management? What is their need? And that's for them to decide with their clinician on what really is going to meet their needs the best. Let me see. I should think of anything else with intake. We don't have a wait list for any of our programs. We're not full by any means, so clients can definitely get treatment pretty quickly right now. All right. So I just wanted to show this chart because it's something I'm looking at a lot and trying to reduce that number. So for open access, right now, from the time you walk in till you've been admitted, it's about 26 days. So what that means is that in that time, they've had 2 appointments. They've had their intake 1 and their intake 2, and they're being admitted into our program after 26 days. That number continues to go down. And from my understanding, a few years ago, it was up in the 100. So we've done a lot to really improve this process. If someone's coming in and their needs are more acute, we will triage them and get them in quicker. Just like a doctor's office, if somebody cancels, we have a list of clients we're calling to get in sooner. So we're working really hard on that number and really trying to get clients in here as quickly as we can to provide services for them. It's been really helpful with the amount of staff we've been able to hire over the last year. And some of the reasons we've been able to do that are just some systemic changes, right? So we have this HRSA loan repayment program where clinicians can work here and they'll get their loans forgiven in about 3 years. We've worked to reduce some of the barriers of the civil service exam. So all of that's really helped, increasing supervision, things like that, have really helped to being able to retain our staff, which is going to directly influence our clients. So one of the goals we have for this year for training is we're going to really increase our training on suicide prevention treatment. So we have a zero suicide committee that meets monthly. We're working on a training plan right now. Currently, we're getting everyone trained in counseling and assessment of lethal means, but we're gonna make that a little bit more comprehensive and really focus on this year. So right now, I think we're doing exceptional risk assessments, and we need to continue to just work on the treatment we're providing for people who are experiencing suicidal ideations. The other focus is on trauma-informed care. Always trying to get better at this. And we've done a lot just in our physical building lately to try to make it more welcoming, less like a government building and more like a therapeutic environment that people can come to and feel safe. So we've done a lot of work with that. All right, that was all the things I wanted to share, but I hope people have questions that they can ask.
Thank you, Hillary. That was very comprehensive. I tried jotting some things down to ask you, but I'm going to pause first and see what questions everyone else has. Okay, I'll get us started.
Okay.
So I noticed I was trying to do the math in my head, and I'm not good at mental math, but it looked like once you added the Brown Road location, you actually now are seeing more clients in 2025 compared to 2024, which is not just like a redistribution of clients, but you're actually increasing access, which is awesome. Wondering what other barriers to access you are contemplating addressing in the year ahead.
Mhm. Yeah, so I think that something we need to really do is push out a little bit more into the community. I think, you know, the biggest barrier is getting people here. And of course, that's always individualized for each person on the reason for that. So, you know, we're looking at providing more services in, you know, some of our housing, supportive housing, communities as well as community locations. You know, when we go to some of those places, the clients are like, you know, I hear they're waking up in the morning asking when we're gonna be there, right? Like they're excited to see us. And they're, you know, if there's any reason there has to be a cancellation, it's really disappointing. So we want to provide more of that. I think it's hard for people to get here and to walk in the building and to take that big step. We've expanded the amount of clinicians that can do our open access as well. So no one's being turned away if they're coming in for an appointment. We'll find someone, I'll meet with people for intake, whatever we have to do to make sure that clients are being seen for intake that day, we're making sure that we do that. I think, you know, in the past, we've hit a certain number and we said, okay, we can't see anyone else today, but we're meeting with people if they're coming in and they need services. Trying to think of what else. I think increasing those peers that we would like to increase and get more peers. They've been extremely helpful with engagement. And being able to, again, go out to people and help them with the barriers that they're identifying.
I think Beth has a question.
Hillary, when you talk about expanding the programs, especially out in the rural areas, is it that you need facilities to hold your services, or are you handicapped by a lack of staff? What would your needs be to expand out in a rural community?
So I think the Brown Road was our first, you know, kind of attempt at that, right? So we're out, it's closer to some of the rural communities than downtown. But we also are offering, you know, right now, children's services out in the schools. So the biggest barrier for that is just we need to hire more people, more clinicians to do more services, is really what that's coming down to. And I think, you know, we're working on different partnerships with different community organizations that we can, you know, be located at so that we can offer services as well. So right now, I think the biggest barrier is just hiring more people. We can do it. We have the, you know, people that want to do it. They want to go out. We have the want for it. We have the technology for it. So it's just, you know, actual workforce.
Thank you.
What other questions do you have for Hillary? Oh, sorry, Chris.
Hi, Hillary. Thank you so much for that. Yeah, I was just sort of had a broad question. What is it that you would like some of the other community organizations to be thinking about in terms of developing programming to support the work that you're doing or the work that you're planning on doing over the next, 12, 18 months? And that would go for both, I think, sort of human services, non-clinical work, but also some of the clinical organizations that work with Medicaid populations. It would just be interesting to hear sort of where you're starting to see the gaps and what you're hoping for in terms of cooperation and collaboration.
So I think I guess what I would ask is just communication and curiosity, right? I think that sometimes not the right information gets out there. And so if anyone has any questions or ideas about things or is just curious, like please ask, reach out. And I think I mean, to me, it's just a matter of communicating. To me, that's what's important. I don't know if that answers your question.
Yeah, yeah. No, is there anything particularly around communication that's been sort of a gap that you think that could be worked on, be supportive for you?
Well, I don't think so. I mean, if you're transferring clients to us, just getting, sharing with us releases so that we can ask questions and kind of know where the people are coming from. I think that's really important. It's difficult sometimes to get that. Can't really think of anything else.
Sure.
Thank you so much, Hillary. I guess along those lines, can you put your email address in the chat so folks here can reach out to you for collaboration?
Yeah, absolutely.
Thank you so much. All right. We have our second presenter now with us, Jenny Miller, COO of the Mental Health Association. Jenny is a mission-driven leader with over 30 years of experience in nonprofit administration, strategic growth, and community impact. As the COO of the Mental Health Association since February 2023, she provides strategic oversight of finance, operations, human resources, compliance, and programming. In addition to her leadership role, Jenny is a certified peer specialist, offering direct support to individuals navigating mental health challenges. Committed to community service, she has served as treasurer on the boards of Green Springs Natural Cemetery, Ithaca Welcomes Refugees, and Running to Places. Outside of work, Jenny is an avid gardener and a devoted caretaker of her 3 rescue cats. Turn it to you, Jenny.
Hi, everyone. I'm going to go ahead and share my screen and get it on presenter mode, hopefully correctly. Can you all see that? Yay. I want to start off by thanking Hillary, and she mentioned peer specialists a number of times in her presentation and how valuable they've been. And so I feel like this is a great, it was a good lead into some of what I'm going to be presenting today. So a little bit about us. We've actually been around since 1954. We are one of 25 mental health associations in New York State and over 140 national affiliates of Mental Health America. I spelled community wrong. We're a community-based nonprofit. Our agency is a peer support agency. We are peer-led, peer-run, and staffed by peer specialists. And currently we are comprised of seven staff members. And we have ongoing volunteers and student interns. So often folks don't know what a peer specialist does. And again, Hillary introduced some of what peer specialists do, but I like to show this slide that there is a number of things that we do, that we educate, we facilitate, we advocate, we offer hope, we provide self-help, and hugely we dispel myths. So that's what all of us do every day in our jobs. What does it mean to be a peer specialist? Again, a lot of folks don't know what kind of training that we have in order to do the job that we do here at the Mental Health Association. And here, everyone is a certified peer specialist. That means that we've completed online coursework. We have supervision, which means 2,000 hours of supervised work. And then there are requirements, 18 years of age, high school diploma. So there are actually certifications for what we do. And I want to say we're not clinicians. And I really want to make that not, you know, it's just different. We're not clinicians, we're peers. We are people that are willing to talk about and use our recovery. We all consider ourselves in recovery in order to help others. Oops, I went through that one. We also, and I'll talk about this a little later on in the presentation, we last year hired a certified recovery peer advocate. So that is somebody who used their lived experience with substance use in order to offer recovery to others. So the SERPA that is on our staff is also a certified recovery, certified peer specialist. And I'll talk about that later on in the presentation. So we have a number of programs. We offer peer counseling, family support services, justice services, and recovery services, our psychosocial services, and our community education. And I'm going to talk about each of those programs briefly. So what is peer counseling and advocacy? One, I need to point out that all of our programs are for anyone 18 and older. So we do not offer programs for teens or for children. I'll get into that a little bit more in our family support, but for our programs, you need to be 18 or older. And in our peer counseling and advocacy, we have a range of activities and help that we offer, self-help education, service coordination, goal setting. And for our peer counseling, a lot of people don't know that we offer 12 free sessions for one-on-one peer counseling. So that is in our office. Anyone can partake of that. We currently don't have a waiting list. And in these peer counseling programs, we use mental health community partners and CarePath. These are programs people have been trained in through the Office of Mental Health with New York State. And we also use WRAP, which is an internationally known evidence-based program. So we incorporate those programs as part of our peer counseling work. But then we also just use a lot, like sharing from our own experience. So peer counseling session can range from using one of the programs I just mentioned to help somebody with, goal setting or working on any topic that they'd like to bring up. We do a lot of advocacy work, meaning we might assist somebody filling out paperwork or attending an appointment with them. Actually, a lot of it, we're doing more and more work helping people navigate systems that they're looking for housing, they're looking to be insured. That's coming up a lot for us lately. One of the things that I want to mention about peer counseling is it's different than a clinician. And in fact, I feel like it can be a support. There are instances where somebody may not want to bring up something with a clinician that they may want to discuss with a peer that has been through that same experience. So there may be, or it may be that first they want to test something out with a peer in order to build up to bring it to a clinician. So there are periods, there are reasons why someone may want to speak to a peer. And I really want to, it's different than a clinician. And what we hope is it's a support. And we often refer people to the PROS program. We often refer people to clinicians, but we are just one of the pieces in a wider safety net. So that's sort of our peer counseling and advocacy program, and within that we do offer a lot of groups. These are just some of our current groups, some previous groups. One of our most popular groups for many years has been our senior group that takes place every Wednesday. Also very popular is our mutual aid lunch break. We have offered things in the past like breath, body, mind, self-help with DBT skills. We're just starting a smart recovery group. So these are ongoing, and you can find out more information on our website, on our calendar. Next, I have justice and recovery services on the same slide. I'd like to mention, just because somebody is seeing us for recovery services does not mean that they are in any way justice involved. But I put this on the same slide because our recovery program is newer. And currently they do a lot of work on site at the Ithaca Wellness Recovery Court, County Court, Tompkins County Probation and Family Treatment Court. So we've been working within the justice system within Tompkins County for a long time. And so the two peers that you see in this picture, Katie Donovan and Larry Albro, meet people on site there to work through goal setting. Basically, the idea is to keep people out of the justice system. And in fact, we often, as part of various programs, we will even get referred. People need to come to our services as part of their programs with any of these courts. Our recovery program is newer. This was actually funded, a pilot program by Park. They funded us for part-time. This started with a bang last fall. And Katie immediately had a more than full caseload. So we're funding half of this program. And so she's not only working in the courts, but she's seeing folks at the office for anyone recovering from any type of substance use. And she's starting a smart recovery group. So we are hoping to hire more for that, since it's such a well-utilized program. So we're currently looking for funding, but similar to what Hillary talked about, they're looking for a court navigator. That's a lot of what we do in the justice program, but from just a different angle, because they're, again, not clinicians, peers. So it's just support from a different angle. Then a huge part of what we do is education of stakeholders in the justice system regarding mental health recovery. So that would be judges or lawyers or anyone involved in the process. We have our psychosocial program. A lot of people know us mostly for this program, but as you can see, we do a lot in our work at the Mental Health Association, and this is mainly our largest program is our social drop-in program, when anyone can come in who would just like to socialize, meet with somebody, not feel alone. You can drop in, you don't have to sign up, you don't have to let anyone know, they're just open hours. Currently it's Wednesday 12 to 3, Thursday 3 to 7. Again, for anyone 18 and older. We're hoping to expand those hours, but with current staffing, that's currently the hours we have available, though we think with some interns, we might be able to expand the hours to Tuesday. And then we have various activity groups. For example, I just started a walking group, just a place to just socialize, meet with people, feel less alone. And then we do have a family support program. This program is for parents and caregivers raising children and young adults up to age 21. So we do not meet with anyone under the age of 18. We meet with families. So we may meet with families and children in the family, but it's for the caregivers or the entire family unit. So that we offer a range of services: information referral, family resilience, caregiver self-care is hugely important, whole family wellness, skill building, and communication skills. And we utilize the Care Path program through the Office of Mental Health for much of what we do for the family support programming, and then family fun events. I'm going to give myself a quick time check here. All right. Oh, 1 second. My screen doesn't want to go back to full mode. All right. And then we also offer community education. So we offer community workshops, and many of you may know our program from mental health first aid workshops that we do. All of our programming is free. The only one that is not is the mental health for first aid for community organizations and individuals, though we offer it on a sliding scale fee, and that is because we incur charges on our end to offer the programming. So really quickly, I want to go through some of the highlights and some of the challenges we've experienced over the last year. Huge highlight was the pilot program for recovery services. Like I said, we do have actually a small wait list for that, and it is really at capacity, our justice services and recovery services, meaning our staff see up to 20 participants at a time for both of those services. So we're actively looking for funding to expand. And number two, I can't tell you how huge this is for us, completing the purchase and major renovations of permanent home. My next slide will show you pictures. We are now located at 511 West Seneca Street. So it's a permanent home. We bought it. We've never had a home after 70 years. It needed major renovations. The last 6 months, I will say, has mostly been moving into this new home and renovations and trying to work around all that means to really set us up for success and really expand. And I really wanted to point out our collaboration with ChoiceWords grant writers to diversify our funding. This has been a huge goal for us. I think we've written 8 grants in the last 6 months that we are really working hard to diversify our funding. Most of our funding comes from the Office of Mental Health. And for many factors, we really want to grow, but also not depend on one source for most of our funding. So that's been a major change for us. And a lot of what I've been doing. So I want to kind of mention the challenges. Our previous location was really difficult for us in Center Ithaca. I want to say we saw our numbers drop. People found that it was not ADA compliant. Often the elevators would be down, bathrooms were not working correctly. So that was very difficult for us. It really lacked visibility. We heard a lot of folks who were unhappy with that location and access. And so part of the incentive to move was to really become a place that was much more accessible and available to the community and build partnerships. Number two, I want to mention is organizational confusion with Tompkins Whole Health. And I want to say that this is something I think Tompkins Whole Health is aware of too, and we've been working on that. I think the name confused folks for a while. We're working on rebranding. So usually in the morning when I come in, we have a number of phone calls, people thinking we're Whole Health because of the name Mental Health Association. And I know we're all working on it, but I still want to mention this for anyone here who wants to refer someone to the Mental Health Association, making sure to let them know we're not the mental health clinic. They're really different. So we're hoping with the new location that's going to help that and some of our new branding. And again, and I think part of it too is that we want to work in partnership with each other and really support the work. And that's why it can be confusing too. I want to mention stagnant OMH funding. The bulk of our program is from the Office of Mental Health. It's 90% of our funding, and it's been very stagnant. And it's been really difficult for us because we've wanted to be living wage employers. And so we've had less and less staff and with about the same amount of funding. And it was really heartbreaking for us to realize we couldn't make the living wage numbers when that number shifted recently. And that's part of the reason we want to bring in more funding. We prided ourselves on that. Really quickly through the rest, I'm sure other people might know that recovery is not linear. So sometimes we have staff turnover, staff burnout, doing more with less. That's something we're constantly working with. Persistent mental health stigma around the work that we do. Some of it for grant writing having only anecdotal evidence, hard to show reduced hospitalizations from the work that we do. Undervaluation of peer services. I see that changing. Again, I was really excited by Hillary's presentation, and again, her presenting, again, for an example, how whole health, sees the value in those changes in that way. And a persistent challenge that we're facing is the fear of the unknown tied to essential benefits, housing, food, medical care, real and intensifying. There's a lot of fear that we're seeing right now, and it's really changing our services and what people need. Again, I'll try and go quick. These are some highlights. The purchase of our new house, we really wanted to create a homey atmosphere so that the healing in some ways already begins by someone coming in through the door and seeing a really a home-like cozy atmosphere. There's still renovations happening. You can see a kitchen there. We're hoping to find funding to start up community dinners once a week, like soup and bread, and really invite the public in more. And invite other organizations to our drop-in hours. I want to mention that the PROS program has come quite a bit to just be there once a week during our drop-in program so that they can talk about their services. Somebody from Challenge comes once a week. So we do have other organizations, which I know was a question earlier about how organizations can work with each other. We invite anyone to come in during our drop-in hours to talk to participants. And our services are provided phone, Zoom, in person, individually, group setting. We'll meet somebody however they want to participate in order to be accessible. And you can look at, our website has our current June calendar. It's a little light. We just opened in our new space a week ago. So we're still adjusting. And I want to leave it open for some questions.
Thank you so much, Jenny, and congrats on the new space. What questions or comments do folks have for Jenny? Hillary.
I was just wondering if you knew any good resources for training for peers, additional trainings.
Yep. So I don't know. We have all been trained through the Academy of Peer Services, which is partnered with the Office of Mental Health. So we all have taken our coursework through the Academy of Peer Services, and then they have ongoing trainings.
Okay, thank you.
And I can certainly provide additional trainings if your peers are interested beyond that, because that's a huge part of what we do, staff development and ongoing training.
Okay, great. Thank you so much.
Hillary, I'm actually going to put a link to in the chat of one other MC TAC. Well, everyone can see it, but I know we have limited time, so I'm trying to be short.
There's also, Jenny, a question for you. Is the Jenkins Center still active?
So the Jenkins Center is the drop-in center here in the building. So it's so actually we have a plaque right in front, Jenkins Center. So that is our social drop-in Wednesdays and Thursdays. And again, we have quite a number of grants out there. We'd really like to extend to 3 or 4 days a week, and we'd love to see Saturday hours.
I have just two things to call out. One, I wrote in the chat, a big takeaway for me was the need for community education about the role of peer specialists. And that's something that I think we can all take away in our own respective roles, providing community education. And then the other is of like a little tip for you in case you haven't considered work study positions for MHA. I have really good experience working with Cornell, and I know IC also has a work study program, and it's really a wonderful way to bring students in who have some additional accountability because they're getting paid.
I should have mentioned that. You are so right. In fact, we have 2 work study students this summer, both from Cornell, and they are amazing. I love them. They can never leave.
So glad to hear that. All right, I think we have time for one more question before we adjourn. I think everyone's still waking up from the weekend. All right. Well, thank you so much, Jenny and Hillary, and really wonderful to have you with us today. And maybe Jenny, could you put your email in the chat as well so that folks can follow up? And Nicole, was there anything else that I may have missed before I announce the last meeting? Our next meeting is September 8th. Do you want to say something about that meeting?
Yeah, no, we're all set for September 8th, so we're off for July and August, and I believe that one is, let me double check here, it is in person with location TBD. I'll probably reach out to get a poll for preference for that meeting.
Thanks, Nicole. And thanks everyone here. Maybe we'll see you at Juneteenth for Pride in the Park this weekend. Hope you have a great week.
Thank you. Take care.
Bye, everybody.